Are you a diabetic tired of battling constant fatigue, persistent brain fog, or that nagging numbness in your feet, even when your blood sugar numbers look okay? You're diligently counting carbs, taking your medications as prescribed, and doing everything you believe is right. Yet you still feel like something is profoundly off. It's a frustrating paradox, isn't it? You're putting in the effort, but the results, especially regarding your energy levels, mental clarity, and overall well-being, aren't what you hoped for. Many of my clients share this exact sentiment, feeling defeated because they've tried everything their doctor recommended and still struggle with unexplained symptoms. What if I told you that the missing piece in your diabetes puzzle isn't about more medication or stricter diets, but something far more fundamental that most medical professionals frequently overlook? Imagine if the very symptoms that are draining your life and hindering your progress could be traced back to simple, correctable imbalances within your body, hidden deficiencies that are silently undermining your efforts. Today, we are going to expose the 5 critical nutrient deficiencies that are secretly sabotaging your diabetes management, making your symptoms worse, and how addressing them can genuinely transform your energy, improve your nerve health, and boost your overall well-being. This is the hidden truth that could shift your entire health trajectory. I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience. I've witnessed firsthand how understanding and correcting these overlooked micronutrient imbalances are absolutely crucial for thriving with diabetes. Stay with me, because what you learn today has the potential to redefine your journey. Make sure you hit that subscribe button and turn on notifications so you don't miss our weekly health breakthroughs. Nutrient number 1. Vitamin D, the sunshine hormone's dark secret. Are you constantly exhausted, battling a low mood that just won't lift, or wondering why your cuts and scrapes seem to take an eternity to heal? Your body might be silently screaming for vitamin D, often dubbed the sunshine vitamin, but it's far more than just a vitamin. It acts like a powerful hormone within your body, orchestrating hundreds of vital processes. For individuals managing diabetes, a vitamin D deficiency is incredibly common, and for several compelling reasons. People with insulin resistance and chronic inflammation, both hallmarks of diabetes, tend to have lower levels. High blood sugar itself can increase the excretion of vitamin D through the kidneys, further depleting your reserves. Furthermore, modern lifestyles often involve less sun exposure, especially for those who work indoors or live in northern latitudes. As we age, our skin becomes less efficient at synthesizing vitamin D from sunlight, and our kidneys may also have an impaired ability to convert it to its active form. The impact of inadequate vitamin D on diabetes management is profound. It plays a critical role in insulin sensitivity, helping your cells respond more effectively to insulin and thus better regulate blood sugar. It's a potent anti-inflammatory agent, crucial for counteracting the systemic inflammation often seen in diabetes, which contributes to complications. It also protects your nerves and supports the health of vital organs like your heart and kidneys. When deficient, you might experience chronic fatigue that even a full night's sleep can't fix, unexplained muscle weakness or bone pain, notoriously slow wound healing, a persistent brain fog, and noticeable mood changes. You might also find yourself more susceptible to infections, and in some cases, it can even impact fertility. It's not just about bone health. It's about foundational metabolic and immune function. So how do you fix it? Your primary source should ideally be sunlight exposure, safely and consistently. Aim for 15 to 20 minutes of direct midday sun exposure on exposed skin, without sunscreen, a few times a week, if your location and skin type permit. When it comes to food, incorporate fatty fish like wild-caught salmon, mackerel, and sardines. Cod liver oil is another excellent source, as are egg yolks and UV-exposed mushrooms, which can be surprisingly potent. Many foods are also fortified with vitamin D, such as milk and some cereals, but always check labels. For supplementation, it's crucial to prioritize vitamin D3, cholecalciferol, over vitamin D2, ergocalciferol, as D3 is the form your body naturally produces and utilizes more effectively. Dosage should always be discussed with your doctor, as it's a fat-soluble vitamin, and levels can be checked with a simple blood test. What should you avoid? Highly processed vegetable oils and refined sugars or carbohydrates can worsen systemic inflammation, which in turn can deplete your vitamin D levels and hinder its function. Focus on a whole food, nutrient-dense diet to support optimal absorption and utilization. Nutrient number 2, vitamin B12, metformin's hidden toll. If you are currently taking metformin, the most commonly prescribed medication for type 2 diabetes, and you are experiencing persistent numbness, tingling, or a burning sensation in your hands or feet, or that crushing, inexplicable fatigue that blankets your entire day, then listen very closely. This nutrient, vitamin B12, is highly likely to be a major part of the problem. The biggest reason diabetics, particularly those on metformin, are deficient in B12 is the medication itself. Metformin is a fantastic drug for blood sugar management, but it has a well-documented side effect. It interferes with the absorption of vitamin B12 from your gut. This isn't a rare occurrence. Studies suggest that up to 30% of long-term metformin users develop a B12 deficiency. Beyond metformin, high blood sugar levels can damage the stomach lining over time, further impairing B12 absorption. Additionally, as we age, our stomach acid production naturally decreases, which is essential for releasing B12 from food so it can be absorbed. Vitamin B12 is absolutely essential for energy production at a cellular level, for DNA synthesis, and critically, for the repair and maintenance of your nerve sheaths. This is why a deficiency is so directly linked to diabetic neuropathy, where nerves are damaged, leading to those uncomfortable sensations of numbness, tingling, or burning, often starting in the feet and hands. Without adequate B12, your body struggles to produce healthy red blood cells, leading to extreme fatigue, dizziness, and even shortness of breath. It significantly impacts brain function, manifesting as memory loss, brain fog, difficulty concentrating, and increased anxiety. Furthermore, B12, along with folate, is vital for regulating homocysteine levels. Elevated homocysteine is a silent but significant risk factor for heart disease and blood clots, both of which are already elevated in diabetic individuals. To correct this, prioritize food sources like beef liver, which is a powerhouse of B12. Other good sources include clams, sardines, salmon, and eggs. However, for those on metformin or with significant absorption issues, dietary intake alone may not be enough. Supplementation becomes crucial. When choosing a supplement, it is absolutely vital to select methylcobalamin, methyl B12, which is the active, bioavailable form your body can immediately use. Avoid cyanocobalamin, the synthetic form often found in cheaper supplements, as many people struggle to convert it effectively. For those with severe absorption problems, sublingual, under the tongue, forms or even B12 injections may be the most effective way to ensure adequate levels reach your cells. What should you actively avoid if you're concerned about B12? Excessive alcohol consumption, a diet high in refined grains, and the long-term use of stomach acid blockers, proton pump inhibitors, or PPIs can all further impair B12 absorption. Refined sugar and fast food, while not directly depleting B12, contribute to an overall nutrient-poor diet that exacerbates deficiencies. Nutrient number 3, folate, vitamin B9, the cellular repair master. Are you still feeling consistently run down, struggling with mental clarity, or finding that even simple cuts and bruises seem to take an unusually long time to heal? Folate, also known as vitamin B9, might be the critical missing link in your diabetic health puzzle. This often overlooked B vitamin is a true master of cellular repair and regeneration. For individuals with diabetes, several factors contribute to folate deficiency. The disease itself can impair the absorption and utilization of folate within the body. High blood sugar levels contribute to systemic inflammation and oxidative stress, both of which increase the body's demand for folate. Like B12, metformin can also interfere with folate metabolism, making it harder for your body to process and use it effectively. Additionally, increased urination, a common symptom of uncontrolled diabetes, can lead to higher excretion of water-soluble vitamins like folate. Folate is crucial for myriad bodily functions. It's a cornerstone for DNA repair and synthesis, meaning it's vital for every single cell in your body to replicate and function correctly. It's essential for the production of red blood cells, impacting your energy levels and preventing certain types of anemia. Folate also plays a key role in gene expression, ensuring that your genes are functioning as they should. It works synergistically with vitamin B12 to reduce inflammation and optimize insulin sensitivity. When folate is deficient, you might experience chronic fatigue, muscle weakness, a noticeable delay in wound healing, persistent brain fog, memory issues, and difficulty concentrating. It can also contribute to anemia, characterized by paleness and shortness of breath, and, like B12, elevate homocysteine levels, increasing your risk for cardiovascular issues. To ensure adequate folate intake, focus on food sources like beef liver, which is exceptionally rich in folate. Dark leafy greens such as spinach and kale are also excellent sources, as are lentils, asparagus, and avocado. For those struggling with absorption or with genetic variations that impact folate metabolism, like the MTHFR gene mutation, which is surprisingly common, dietary sources might not be enough. This is where supplementation becomes crucial. Again, it is absolutely essential to choose methylfolate, which is the active, methylated form of folate directly usable by your body. Avoid synthetic folic acid, which is found in many fortified foods and standard supplements, as many people lack the enzyme to convert it to its active form, making it poorly utilized and potentially even harmful in high doses. To optimize your folate levels, avoid refined grains like white rice and white bread, which are stripped of their natural folate content. Excessive alcohol consumption, high-sugar diets, and certain medications, including metformin and some antacids, can also interfere with folate absorption and utilization. Prioritizing whole, unprocessed foods is key to maintaining adequate levels. Mineral number 4. Magnesium, the blood sugar stabilizer. Are you experiencing frustrating muscle cramps that wake you up at night, persistent anxiety, restless sleep, or even stubborn blood sugar spikes that seem to defy all your efforts? Magnesium is often the overlooked mineral for diabetics, yet its role in blood sugar regulation and overall well-being is absolutely fundamental. Magnesium deficiency is remarkably prevalent among individuals with diabetes. High blood sugar levels cause increased urination, which unfortunately leads to a greater excretion of magnesium from your body. Furthermore, insulin resistance itself can impair the absorption of magnesium from your digestive tract. The typical modern processed diet, which is high in refined carbohydrates and low in whole foods, is often woefully inadequate in magnesium, contributing to widespread deficiency even in the general population, let alone those with increased needs. Magnesium is an incredible mineral involved in over 300 enzymatic reactions in your body. It is critical for glucose metabolism, helping your body process sugar effectively. It directly improves insulin sensitivity, making your cells more receptive to insulin and thus helping to lower blood sugar levels naturally. Magnesium is vital for proper nerve function, muscle relaxation, and even blood pressure regulation. When you're deficient, you might experience frequent muscle cramps, tremors, increased anxiety, difficulty falling asleep or staying asleep, insomnia, restless leg syndrome, and even migraines. Its deficiency can also contribute to high blood pressure, a common comorbidity with diabetes, and critically worsen insulin resistance, creating a vicious cycle for diabetics. To increase your magnesium intake, focus on a diet rich in dark leafy greens like spinach and kale. Nuts such as almonds and cashews are excellent sources, as are seeds like pumpkin seeds and chia seeds. Include legumes, dark chocolate, at least 70% cocoa, avocado, and whole grains in your diet. When considering a supplement, aim for highly absorbable forms like magnesium glycinate or magnesium citrate. Magnesium glycinate is particularly good for sleep and anxiety due to its calming properties, while magnesium citrate can also help with occasional constipation. It is crucial to avoid magnesium oxide, which is poorly absorbed by the body and primarily used as a laxative, offering little systemic benefit. What should you avoid? High sugar intake significantly depletes magnesium levels. Excessive alcohol consumption, chronic stress, which causes your body to burn through magnesium rapidly, and the long-term use of certain medications, such as diuretics and proton pump inhibitors, PPIs, can also negatively impact your magnesium status. Prioritizing stress management and a diet rich in whole, unprocessed foods are key to maintaining healthy magnesium levels. Nutrient number 5. Omega-3 fatty acids, the inflammation fighter. Chronic inflammation is an undeniable hallmark of diabetes, silently contributing to everything from persistent joint pain to the devastating complications of heart disease, kidney issues, and nerve damage. But there's a powerful anti-inflammatory warrior you might be critically missing: omega-3 fatty acids. The primary reason most individuals, especially diabetics, are deficient in omega-3s is a severe imbalance in the modern diet. Our diets are typically overloaded with omega-6 fatty acids, found in abundance in processed vegetable oils like corn, soybean, and sunflower oils, and processed foods. While omega-6s are essential, an excessive ratio compared to omega-3s promotes inflammation. Many people simply do not consume enough adequate sources of omega-3 rich foods, such as fatty fish or specific plant sources. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are potent anti-inflammatory agents. They play a crucial role in cooling down the systemic inflammation that drives many diabetic complications. Beyond inflammation, omega-3s powerfully support heart health by lowering triglycerides, reducing blood pressure, and improving blood vessel elasticity. They also significantly improve insulin sensitivity, helping your cells respond better to insulin. Furthermore, these healthy fats are vital for brain health, supporting cognitive function, and are essential for maintaining healthy vision. When deficient, you might experience chronic pain, stiff and achy joints, an increased risk of heart disease and stroke, worsening kidney issues, progressive nerve damage, and even symptoms of depression. To boost your omega-3 intake, prioritize fatty fish such as wild-caught salmon, sardines, mackerel, anchovies, and herring. These are the richest sources of EPA and DHA. For plant-based omega-3s, ALA, which your body converts to EPA/DHA to varying degrees, incorporate flax seeds, chia seeds, and walnuts into your diet. When considering supplementation, choose a high-quality fish oil that provides substantial amounts of both EPA and DHA. Look for brands that are third-party tested for purity and potency, ensuring they are free from heavy metals and contaminants. Always follow dosage recommendations and consult with a healthcare professional, especially if you are on blood-thinning medications. To reduce the inflammatory burden and optimize your omega-3 status, significantly reduce your consumption of excessive processed vegetable oils, which are high in omega-6s. This includes avoiding fried foods and highly processed snacks that often use these oils. Focusing on a whole food diet, rich in fresh produce, lean proteins, and healthy fats, will naturally help balance your omega-6 to omega-3 ratio and foster a less inflammatory environment in your body. So, there you have it, the 5 critical nutrient deficiencies: vitamin D, B12, folate, magnesium, and omega-3 fatty acids that are often the hidden reason behind your persistent diabetes symptoms, despite all your diligent efforts. Remember, effective diabetes management is not just about rigidly controlling blood sugar. It's about embracing holistic health, and these crucial micronutrients are an immense, often overlooked piece of that complex puzzle. Your body is an intricate system, and addressing these fundamental nutritional gaps can unlock profound improvements in your energy, nerve health, mental clarity, and overall vitality. While these nutrients are incredibly powerful and foundational to your health, I must emphasize a crucial point. Always consult your doctor or a qualified healthcare professional before starting any new supplement regimen, especially if you are currently on medication for diabetes or any other condition. Getting your levels tested through blood work can provide objective data and guide your supplementation strategy, ensuring it's safe and effective for your unique needs. Your body will thank you for this personalized approach. Now, I want to hear from you. Which of these deficiencies resonated most with your personal experience? Have you noticed any of these symptoms in yourself, or perhaps even in a loved one managing diabetes? Share your story and insights in the comments section below. I make sure to read every single one, and your experiences can truly help others in this community. Starting today, take a proactive step. Begin incorporating more of these nutrient-rich whole foods into your diet this week. And if you're among the many individuals on Metformin, seriously consider having a candid discussion with your doctor about testing your B12 and folate levels. This simple step could reveal a critical piece of your health puzzle. If this video opened your eyes to a new truth about managing diabetes, please give it a like. That really helps us reach more people who need this vital information. Share it with someone you know who needs to hear this message, especially a fellow diabetic who might be struggling with unexplained symptoms. And don't forget to subscribe to Daily Health 365 for more empowering health insights and breakthroughs every single week. Thank you for watching, and remember, knowledge is power, especially when it comes to your well-being.